You're cutting vegetables and the knife slips. Deep gash across your palm. You grab a cloth, apply pressure, maybe text someone to drive you to urgent care. A few stitches, some antiseptic, a tetanus shot, and you're home by dinner. Now take all of that away. No hospital, no stitches, no antiseptic, no tetanus shot, no doctor, no nurse, no one who went to school for this. Just you, a deep bleeding wound, and whatever the people around you happen to know. That was every injury for 300,000 years. And here's what makes this remarkable. We have skeletons, thousands of them, and those skeletons tell a story that should be impossible. Ancient humans survived injuries that would be life-threatening without modern medicine. Broken femurs fully healed, skull fractures knitted back together, amputated limbs with bone that continued growing after the cut. These people didn't just get hurt and die. They got hurt, got treated, and lived. So what were they actually doing? Let's start with the most common killer, not the injury itself, the infection that followed. A cut in the ancient world wasn't just painful, it was a countdown. Bacteria enter the wound. Without intervention, infection sets in within 24 to 48 hours. Without antibiotics, a serious infection becomes sepsis. Sepsis shuts down your organs. You die. This is what killed people far more reliably than the wound itself. So ancient humans had to solve infection before they had any concept of what bacteria was. And they did. Archaeologists and anthropologists studying modern hunter-gatherer groups have documented dozens of plant-based wound treatments that turn out to have genuine antimicrobial properties. The Hadza in Tanzania pack wounds with specific tree barks that laboratory testing has confirmed inhibit bacterial growth. Indigenous groups in Australia use the sap of certain eucalyptus species on open wounds. The same compounds are now used in commercial antiseptics. Honey, available across most of the ancient world, is a natural antimicrobial. It draws moisture out of bacteria through osmosis and creates hydrogen peroxide as a byproduct. Modern medicine still uses medical-grade honey on wounds that don't respond to antibiotics. These weren't accidental discoveries. They were accumulated knowledge, passed down through generations, tested over thousands of years of trial and survival. If it worked, you lived, and you taught it to your children. If it didn't, that knowledge died with you. Beyond plants, ancient humans used fire. Burning a wound closed was practiced across cultures on every continent. It destroys surface bacteria, seals blood vessels, and stops bleeding. Brutal, effective. We still cauterize wounds in surgery today, just with electricity instead of flame. But infection was only one problem. Bleeding was the other. Uncontrolled hemorrhage kills faster than infection. A deep wound to a major vessel gives you minutes. Ancient humans understood pressure instinctively, the same way you grabbed that cloth when the knife slipped. But they went further. Archaeological evidence shows the use of natural clotting agents packed directly into wounds. Dried moss, spider webs, powdered charcoal, crushed plant materials. Several of these have been tested and confirmed to accelerate clotting. Spider silk in particular has been studied for use in modern wound closure because of its tensile strength and low inflammatory response. Now let's talk about bones, because the skeletal evidence here is where things get genuinely astonishing. In 2017, researchers studying remains from a prehistoric site in the Philippines found a skeleton with a fully healed amputation of the left foot and lower leg. The bone had been cleanly cut, not broken or torn, and it had healed completely. The individual survived the amputation and lived for years afterward. The site dated to approximately 31,000 years ago. Think about what that required. Someone made a decision to amputate. Someone had a tool sharp enough to cut cleanly through bone. Someone managed the bleeding well enough that the person didn't die on the spot. Someone treated the wound well enough that infection didn't kill them in the days that followed. And the community supported a person with one foot through their recovery. Every single one of those steps had to work. Broken bones tell a similar story. Healed femur fractures appear regularly in ancient skeletal records. The femur is the largest bone in your body. A complete fracture leaves you completely immobile. In the wild, immobility is a death sentence. You can't hunt, you can't flee, you can't gather food. You are entirely dependent on the people around you. And yet the bone healed, which means those people fed them, protected them, and kept them alive for the 6 to 8 weeks it takes a femur to knit back together. Not because they had to, because they chose to. Ancient humans splinted broken bones using sticks and plant fiber bindings. Evidence of this practice appears in Egyptian mummies from 3,500 years ago, but the technique almost certainly predates that by tens of thousands of years. The principle is simple. Immobilize the bone. Keep it aligned. Let the body do the rest. The body is extraordinarily good at repairing bone when you give it the right conditions. Ancient humans figured that out through observation, through watching what happened when they held a broken limb still versus when they didn't. Then there is the procedure that stops everyone cold when they first hear about it: trepanation. The deliberate drilling of a hole through the human skull. The oldest confirmed trepanation site dates to around 10,000 years ago in France, but examples have been found across Europe, Africa, South America, and Asia, hundreds of them. And here's the detail that changes everything. In many cases, the bone around the hole shows regrowth. The patient survived. Not just survived the procedure, survived long enough afterward for their skull to start healing around the opening. Researchers believe trepanation was performed for several reasons: to relieve pressure from head trauma, to treat severe headaches or seizures, possibly for ritual purposes. The tools were stone. The anesthesia was likely alcohol, plant-based sedatives, or nothing at all. And people lived through it with enough regularity that the practice spread across the entire ancient world independently. Multiple cultures on different continents arrived at the same conclusion. Sometimes you have to open the skull, and sometimes it works. But here's what ties all of this together, and what the bones can't fully show you. None of it worked alone. The person with the amputated foot needed someone to perform the amputation, someone to manage the wound, and an entire group willing to carry them while they couldn't walk. The person with the broken femur needed 6 weeks of food brought to them. The person recovering from trepanation needed someone to keep the wound clean and watch for signs of infection. Ancient medicine wasn't just knowledge, it was community. It was the decision, made again and again, across hundreds of thousands of years, that a hurt person was worth saving, that the cost of keeping someone alive, the food, the time, the attention, was worth paying. This is what separated us from every other species. A lion with a broken leg dies. A human with a broken leg gets carried. Today you can walk into a building, describe your symptoms to a stranger, and leave with medication that didn't exist 20 years ago. You take that so completely for granted that a minor injury feels like an inconvenience. For 300,000 years, every injury was a negotiation between your body and death, and the people around you were the deciding factor. They didn't have antiseptic, they had each other, and somehow, against everything, that was enough.